Met a couple of years ago at a place called Covenant House. Guess we fell in love after a couple of months, and she proposed to me. Then I proposed to her back with a ring. Then we got married.
How long have you had Chloe?
About a year and 3 months.
And how did you get Chloe?
They told me about pet access, and at first I wanted a dog, but I thought it was too much responsibility, so I wanted a cat. And when we went to go get her, she was aggressive. She was about 6 months. She wouldn't let nobody touch her, and she was trying to scratch us. So we did get her, and we brought her home, but she kept hiding under the barrels. I had to put gloves on to pick her up. And since then, it's been better. It meant responsibility. It meant having to care for someone else other than yourself.
What about him?
Him? Well, that too, but it's brought us closer too.
Why?
Because if you think you're ready for a child, try having a pet. Because it's the same thing. She gets sick, you got to take her to the vet. If she's crying, you got to feed her. It's the exact same thing.
Right. How do you feel about the cat?
I love the cat very much. I don't know, it's like I think about her, when I'm outside. I have a picture of her in my wallet. Well, yeah, having Chloe's like really exciting, except for the litter part. Well, at night we put her to sleep with us. She sleeps with us. She wakes us up in the morning to eat. She wants food.
She wants food.
And I really love Chloe a lot. She's not like a regular cat, so I get panic attacks a lot. When I do get them, Chloe's there, and although she just stares at me, it looks like she wants to laugh at me for some reason. But she's there, and it's like very comforting because it's somebody here with me, and knowing that she's here, I feel better. It's very comforting. It's something to think about. It keeps your heart warm, and just keeps you happy.
Before I got her, I had anxiety every day to 3 to 4 panic attacks a day, and one of my diagnoses is that I hear voices. And she seen when I used to get sick, she used to come and lay on the bed and curl up next to me. So having somebody else here when I was sick, it was comforting. I think it's very good. I think they should make this for each mental health program that there is, because it does help with mental illnesses. It helps a lot.
When we thought about this program, we thought, okay, what kind of supports are people going to need to make this work? Number one is the financial support. A lot of folks are on disability, basically poor. How are they going to afford to buy the essentials to set up, the leashes, the dog bowls, the food? How are they going to pay for vet expenses? So what we were able to do was to write a grant. And I think the great thing about this program was that there's a structure there, there's an administrative structure there to help everybody work this out in a really productive way. And what we found was, I could think of 2 individuals, one who got a dog and one who got a cat, was that you could just see the glow, like there's one person, the glow on her face when she got this rescue dog. She was so happy. She had a purpose. She would walk that dog 5 and 6 times a day. I saw people's faces light up when they had the pet, when they would go through the process, going to Petco, even going to the vet. It was something that it was an ownership. Both staff and consumers would come back with a glow. They were so excited. It was like a real partnership effort of this is something we're going to do together, and I found that very exciting and thrilling. In the long term, you're able to see people's lives change and be transformed. And that's what I think, if our mission is to work with people to empower them to have fulfilling lives, this is one of those tools. Think about that you're really enriching somebody's life, and in some senses what's going to happen is your job might get easier overall because there may be less crises that a person is going to be going through emotionally. They're not going to be as wrapped up into their self and their symptoms. They're going to be taken care of. I know that I had a person here who a good friend whose bird died, and I thought that she was going to go in the hospital. I immediately got her a new bird. She totally bonded with that bird. She was like another person. She had something to care for. So I think people have to remember that's what it's really all about. And then people see the value of the person pet relationship, and that it's just as important as trying to work on goals towards going back to school and going to work. This is all part of that whole circle of being a recovering person in the community. That this is one tool, and it's a win-win for the pet, for the person, for the program.
I love that dog, where he runs up to me when I call, where he chases his favorite red rubber ball. I love that dog, where he chases his tail all over the place, the way he stands up on his hind legs and licks my face. I love that dog. So even if he is a little bad sometimes he barks too loud at night. Maybe he chases cats over the fence, but he's not the kind that growls, and he's not the kind that bites. I love that dog, the way he puts his wet nose in my hand, and when I tell him my problems, he always understands. I love that dog, the way he catches a frisbee as he leaves, the way his eyes and paws flutter as he sleeps. I love that dog. So even if he is a little bad sometimes, I mean, who isn't? Maybe he barks too loud at night. I mean, is that really bad? No. Maybe he chases some cat over the fence, but he's not the kind that growls, and he's not the kind that bites. And on those days when it seems like I haven't a friend, he's so glad to see me that he wags his whole back end. I love that dog, where he smiles when I pat his head, the way he curls up and snores some nights by my bed. I love that dog. I love that dog. I love that dog. Ooh, oh, 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 oh. I love that.